Kidney transplantation is a surgical procedure wherein a new kidney is transplanted into the body of a recipient or a patient who is suffering from end-stage kidney disease. As compared to dialysis, transplantation is considered to be a better procedure because it offers a better quality of life, it offers a survival advantage, and there are several more advantages of a kidney transplantation over dialysis. However, the patient does have to take lifelong medications, has to undergo his or her regular checkups, and it is extremely important that the patient and his or her family has a good understanding of the procedure of transplantation, because the procedure of kidney transplantation is medically, surgically and immunologically very challenging, and therefore a thorough discussion and understanding and counseling is very important in these patients.